Siziwe, and good morning, everyone, and happy Monday. I'm really excited to be part of one of the first sessions of Evidence 2022. The objective of this webinar is to reflect on the evidence-informed decision-making evidence ecosystem over the past 10 years. And so the aim of the webinar is to share lessons for mutual learning and innovation, and to assess implications of these lessons for the current evidence ecosystem. With us today, we have an esteemed panel who will reflect over the last 10 years and discuss what has transpired in the evidence ecosystem in Africa, reflecting on the various activities to support evidence-informed decision-making and their impact. I will introduce them in turn and invite them to offer a 5-minute reflection on this topic before we'll move to having a more interactive Q&A session where I'll ask the panelists some different questions, and I'm also inviting the audience to submit any questions that you would like to have the panel respond to. So with that, I'd like to start by introducing our first panelist. James Kariuki is a senior research scientist and certified knowledge manager. He works for the Kenya Medical Research Institute in the Office of Resource Development and Knowledge Management. He has over 20 years experience in conducting research in health systems strengthening, conducting systematic reviews, knowledge management and translation, training and capacity development. James, over to you.
Jambo, good morning from Nairobi, Kenya. It's pretty hot here. All right. I want to thank the organizers for giving me this opportunity. Chair, I hope I'm audible now. I'm audible? Very good. Thanks for the thumbs up. Thank you so much. I would like to share with you the history, the present, and the future on evidence-informed decision-making, and especially I'll be drawing from homegrown solutions, so that we may learn from some of the homegrown solutions for informing regional thinking. Share over the past 20 years that I've been working for the Kenya Medical Research, the research ecosystem has actually grown so rapidly that there's so much research outputs, but very little use for local health solutions, primarily because we write for the international audience. Number two, for the funding agencies, which are usually, they fund our research, so they dominate. And number three is that my own observation in those few years is that even the evidence that we generate, the new knowledge that is presented over the time, it's not consumed even by the policy makers and the think tanks, because of quite a number of issues which are well documented and they're in literature. The critical turning point for the Kenya ecosystem turned around just about 15 years ago when the National Assembly, the Parliament, decided that they will downgrade some of the government research institutes, especially the research sector. The health research sector will be downgraded to small departments within the medical teaching university. And therefore, the primary reason was that the researchers who are on exchequer payments or paid by the government, they enjoy salaries to write academic work, and therefore they should belong to the university. That was the policymakers' turning point. And therefore we started asking ourselves, what can we do to have the science that we have generated be incorporated in policy? And therefore, quite a number of local and regional efforts have taken place from just about 1998 to now. Quite a lot of activities have taken place. Please note that in Kenya, just like the East African countries, the health agenda was driven by the political parties' manifestos. And therefore, the aim was to fulfill the political party manifesto and not veer it to advance health. The paradigm shift occurred when the COVID, just about the advent of COVID, and during the COVID pandemic, when now they started looking internally and asking critical questions. And that is where we found ourselves as the Knowledge Management Office, which is only 3 years old. We're only 3 years old. We started now repackaging and resynthesizing our research activities to different targeted audience. We were part of think tanks. We were part of the various community. And therefore, together with public and private partners such as AFIDEP and Ushauri Umati kwa Wote, the universities, both public and private, with the think tanks were formed around thematic issues. That was a turning point. And I am very, very grateful that certain external forces brought us together, and now we are sharing knowledge. Remember, the mosquito that is biting us in the coastal area is the same one in the lake region. It's the same one in Uganda. It's the same one in Tanzania. So the knowledge on the mosquito biting is constant. But how do we use that knowledge has been the biggest aspect, our biggest challenge. Before I go, I would like to say this, that one of the biggest tasks that I have been involved in is what we call knowledge brokerage. This is, in simple terms, what we are doing as part of our knowledge brokerage is that we interact with the policy makers or decision makers at the national level and sub-national levels. And we ask them critical questions. They sit down, they give us the tacit knowledge that they have. We produce the research evidence, synthesized and repackaged. And then we ask the M&E, Monitoring, Innovation and Learning, from the various ministries to give us the service data or financial data. And together, we come up with one solution, what we are calling evidence-informed actions. But the broker, my role as a broker is to to co-check that as they make any action, is there sufficient evidence to support that action? So it's not just giving them or leaving the policymaker with an activity to do or something to read. We actually read together. We act together. That co-production is finally paying off fruits. And it is bearing fruits because one of the things I would just want to conclude is this, is that when you look at our subnational level, and as well as part of the ministry level, most of the decision makers are below the age of 50 years. That is a young, upcoming managers. We have young managers who are moving away from just the traditional party manifestos on health to asking critical questions. The traditional paradigm no longer holds. They're asking critical questions. The older generation are gone back to school and they're earning their doctorates and professional certificates, to the extent that you have quite a number of doctoral holders in some of the very high offices, and they're also asking critical questions. So the space in Kenya on research for health is very, very ripe. But brokerage activities still needs to take place. because we need to move from evidence-informed to decision-making to evidence-informed actions with clear monitoring and evaluation. And that is where that's where we are trickling to. One more thing, there are 11 medical teaching universities in Kenya, both public and private, and the number is still growing. So the supply side of evidence is very, very, very rich. The consumption is so weak, hence the role of brokerage. Allow me to stop here and give it back to the chair. Thank you.
Thank you so much for that, James. Looking forward to getting into some of the details a bit later. So next up, we have Taryn Young, who is a professor at the Faculty of Medicine and Health Sciences at Stellenbosch University. She leads the Center for Evidence-Based Healthcare and heads the Division of Epidemiology and Biostatistics and the Department for Global Health. The Center for Evidence-Based Healthcare has been active for more than 10 years in advancing evidence-informed decision-making through, among others, activities conducting and supporting systematic reviews, providing training of healthcare professionals and stakeholders, and promoting the uptake of current best evidence in health policy and practice. Over to you, Taryn.
Thank you, and good morning all. I want to build on my colleague who has given his input just before me, and I have two key points that I would like to make. In the world of evidence generation, and where we talk specifically of research evidence, because I do think one needs to be clear on what type of evidence we are talking about. So when we speak to research evidence, it's very important to do a synthesis of that evidence so that we can have the totality of the research evidence that's available for a particular question. In order to do that synthesis of the evidence, there's various types of reviews or evidence synthesis that can be done for different types of questions. I'm sure the audience is familiar with systematic reviews. Now we have rapid reviews, scoping reviews, qualitative evidence synthesis, and the list goes on and on and on. But the aim of it is that we can get the totality of the research evidence so that when the knowledge broker provide research evidence to decision makers, they're not providing evidence from one single study, but they are presenting the totality of the evidence. And when you do these synthesis, you are also able, in some cases, depending on the type of synthesis, to be able to look at the certainty of the evidence. How well was the research conducted, and where are the gaps, which in essence inform new research from being done. Because we do have a challenge that we have a lot of unnecessary duplication of new research, and therefore we need to synthesize and let the synthesis inform the decision making for policy and practice, as well as decisions for new research. Now, I want to step back a bit from evidence, talking about evidence generation, and just broadly talk about the evidence ecosystem and what that means, because the overarching topic is for us to be reflecting on evidence-informed decision-making within the evidence ecosystem. If we pick up a dictionary and we just look at what the ecosystem is, you'll see that it's a community of interacting organisms and their environment. So it refers to a very dynamic process. If you look at evidence-informed decision-making, we have so many role players. We have the researchers, we have the regulators, we have those who are participating within the evidence, but then we're doing evidence generation and evidence synthesis and then evidence translation within a broader context where we must be mindful of the political environments, the funding that's available, the regulatory environment, cultural preferences, what is happening in terms of social determinants of health and various other factors. So when we think of the evidence ecosystem, we must always be mindful that this is a dynamic process. It's a messy process. And within that process, we want to all work together to advance health and well-being. And as we reflect on lessons learned and what we can do better, I think we need to think about how can we advance so that the impact that we're aiming to make, we can improve on that impact. I will pause there and hand back to the chair.
Thank you so much, Taryn, for those remarks. Next up, we have Velia Manyonga, who is a research monitoring and evaluation specialist. Velia is also a gender specialist and heads the research section at the Parliament in Malawi. Her work supports and advocates for evidence use among Malawi members of Parliament. And she was the inaugural recipient of the Africa Evidence Leadership Award offered by the Africa Evidence Network. It's a great pleasure to have you on our panel, Velia. Over to you.
Thank you very much.
You're muted, Velia.
Can you hear me?
Yes.
Okay. Thank you very much. Actually, welcome to the Warm Heart of Africa, Malawi. Actually, today I'm very much excited to be part of this webinar and share the evidence ecosystem for Malawi, but specifically zeroing in for Malawi Parliament. Like James, I think let me share with you a bit of a background. Actually, when we are celebrating the 10 years, I'm looking back to the time when I had just joined the Parliament. For your information, Parliament of Malawi, we have got 193 members of Parliament. But when I was joining Parliament in 2011, we were only 2 researchers. Actually, I joined one researcher, and for me, we were only 2 to provide evidence to 193 members of Parliament. But we've now really made a tremendous history. And when I'm looking at this history, sometimes I become emotional when I look at the support which we've gotten from African Evidence Network, but also specifically from our own fellow stakeholder, AFIDEP. You know, our work in terms of AFIDEP, the work of Parliament and AFIDEP started back around 2012. At that time, you know, in the Malawi Parliament, research, we were only providing the research services in terms of evidence, in terms of reaction. We were waiting for members of Parliament to come to us and request for evidence. But then our work with AFIDEP, we focused working on how we can make evidence to be demand-driven. In other words, how we could make our members of Parliament demand evidence in everything they do in Parliament. But also, at the same time, looking at the kind of capacity the people that are responsible for generating evidence have. So when I'm looking at the past 10 years, I'm looking at how we've evolved in the Malawi Parliament, looking at the capacity from those that are entrusted with the responsibility of generating evidence, but also looking at the demand that is generated by the members of Parliament. So this is going to be the focus of what I'm going to present today. And when I'm looking at the evidence ecosystem, one thing that struck in my mind is that whenever we are providing this evidence, there is a need to target the evidence users. The evidence shouldn't just be generic, because I will give you an example. If you look at the type of evidence that is needed by the members of parliament and the type of evidence that is needed by the policy makers from the executive, the type of evidence is quite different. I will talk of members of parliament. They will need evidence because they need to be heard. The people to listen could be government, but also, you know, in parliament, we talk of members of parliament belonging to government and then members of parliament belonging to opposition. Both parties, they still need evidence to be heard by the other party, but also for decision making. So when we look at the past 10 years, to me, the most important thing which we should take home is whenever we are providing the evidence, we need to target the users. It shouldn't just be generic. The executive or the government may need evidence for policy decision making in terms of resource allocation, or in terms of where should they target in terms of projects. While a member of parliament, then they would need evidence, maybe in a committee, to carry out inquiries, to carry out investigations. Those are the moments they will need evidence. So we need to target. And also something I want to share with you when I'm looking at the past 10 years. The past 10 years, when I look at our journey in terms of evidence implementation, our journey has been full of challenges, but also some exciting stories. In terms of the challenge, looking at the 10 years, but also moving forward, one of the major challenges we grapple with in parliament is the retention rate. I'm sure this one is not only unique for Malawi, but also for other countries. For parliament, parliamentary term is only for 5 years. So if you build the capacity for a certain cohort of parliament for the first 5 years, yes, evidence would be championed fully in that particular 5 years, but with the poor retention rate, after 5 years, you need to start all over again. So after every 5 years, we need to start building the capacity from the scratch. For Malawi, the retention rate is 35%. So only 35% of the 193 members of parliament return to parliament. So I always plead to organizers like think tanks that are there supporting parliament in terms of evidence to not stop rebuilding the capacity. I will give a big thank you to AFIDEP. They haven't gotten tired. Since 2012, 2010, they've been building capacity in parliament, not only to the researchers in parliament, but also to the members of parliament. So this one is a big thank you to AFIDEP for doing this, because otherwise we could have said, yes, between maybe 2014, 2019, we had members of parliament championing evidence. But after 2019, it's a different story altogether. But AFIDEP really has provided a lot of sustained work in terms of evidence use. Thank you, AFIDEP. And then if you're not around, but this message should really go to AFIDEP, but also to every organization that is there to build evidence. And sometimes another challenge, which I can reflect for the past 10 years, is sometimes, you know, in parliament, we deal with members of parliament with different educational background. You know, the qualification of becoming a member of parliament, sometimes it's not in black and white to say it has to be master's degree, it has to be, no. You may find that somebody who is well-versed maybe in agriculture is put in a transport committee. So there, this person will have a different kind of educational background. For them to provide evidence, you need to be mindful of this different kind of educational background. So there is a need to carry out an understanding of the target group who are championing the evidence or who are using the evidence. And then sometimes the other challenge with us researchers, even here in parliament, there are times when we are asked to provide briefs to members of parliament, but you find that our briefs are too long, or maybe the words used are a bit technical. But thank you to the capacity building we've had throughout the years, whereby we are put to check ourselves to say, is what I've written really going to be used, or it's too long, or it's too technical? So we are put on a check. But now, having said these challenges, but I should also say the enabling environment for Parliament, and these ones would be kind of generic, not only for Malawi Parliament, but for the other parliaments, be it in Malawi, be it in Kenya, be it in South Africa. You know, we've got a lot of enabling environment. And moving forward, having looked back at the 10 years and also moving forward, I'm a bit excited because having worked for Parliament for over 10 years, I can proudly say, if there is a place where your evidence will be used, then it will be Parliament. Because if your evidence will not be used by government or members of Parliament belonging to government, be assured that your evidence will be used by the opposition. So already this is an enabling environment. So those of you people who are generating evidence, bring the evidence to Parliament. Once that evidence is put in, is well packaged, it will be used be either with the members of the opposition or members of the government. But having said this, we have got a number of enabling factors for evidence to be used in Parliament. The first factor is, in Parliament, we've got what we call standing orders. Standing orders is like the constitution for Parliament. The standing orders are very clear. The standing orders mandates the members of Parliament to use evidence in their debate. So already there is a Bible that is mandating a certain group to use evidence. That's why I'm so proud to say, once you have got your evidence, please bring your evidence to Parliament. And again, apart from the standing orders, Parliaments, we've got the institutional structures that are supporting evidence use. For Malawi Parliament, yes, I've said in 2012 we were just 2 researchers, but for now we are about 9 to 10 researchers. And again, thank you, AFIDEP, for building this capacity. Now, we've got a fully fledged research department that is there to synthesize the kind of evidence you bring to Parliament so that it is ably used by the members of Parliament. So this alone is creating the enabling environment. Apart from the research department, we've got the library, we've got the legal department, we've got the committee department. All these structures are there to support the evidence use in Parliament. And again, you know, timing for providing evidence. For Parliament, yes, evidence is required throughout the parliamentary activities. But whenever there is a budget session where resources are allocated, that's the most critical time when evidence is needed. And again, another beautiful thing is for Parliament, we need all the evidence to support all the cross sectors. If your evidence is in education, be sure you are going to find education committee or people that are supporting education. So during the resource allocation, bring the evidence. If it's health, we've got health, we've got transport, we've got all the sectors of development. So in all these sectors, if we are going to have good resource allocations, we will need the evidence. So timing is also of essence. So whenever there is a budget meeting, that's the most critical area where evidence is demanded by members of Parliament. And then lastly, another enabling factor is whenever members of Parliament are conducting inquiries or investigations in their different committees, they need evidence. They can only carry out their successful inquiries or investigation if they've got evidence. So this evidence can come in the background. This evidence can come in the forefront. But one thing I can say is we need evidence in Parliament. With this, thank you very much. I now am excited when I'm looking at the 10 years and also moving forward. I feel like we are going to have new lessons learned in the next 10 years to come. Thank you very much.
Thank you so much for that, Velia. looking forward to learning even more in our continued discussion. So now I'd like to introduce Eliya Zulu, who is the Executive Director and Founder of the African Institute for Development Policy, or AFIDEP, whose mission is to inform African public policy formulation and implementation with research and related evidence. Before founding AFIDEP, Eliya was the Deputy Director and Director of Research at the African Population and Health Research Center. He has over 20 years of experience developing and managing research and is an internationally acclaimed scholar who has served as the President of the African Union for Population Studies and has been a member of many global development panels. Over to you, Eliya.
Thanks a lot, Betty. And I really have to say I'm really very, very happy to be part of this panel. Thanks to the Africa Evidence Network for putting it together. And thanks to all the other panelists who are on the table. I think for me, when you look at the last 10 years of evidence-informed decision-making field, I would really like to say that I'm very, very excited now. I'm very, very pleased. AFIDEP was actually formed 12 years ago in order to help institutionalize a culture of evidence-informed decision-making in government. So looking at these 10 years, it's more or less like looking at the life of AFIDEP, how we've been in the field and what we've experienced. And I think it's been a period of phenomenal growth for the evidence-informed decision-making field and ecosystem. We've seen increased attention to EIDM and its importance. More people are getting involved. We have more champions from the academic community, government, and from civil society, from the knowledge broker institutions, the number of which has grown a lot. Research organizations are framing their mandates more from an evidence-informed perspective. So it's really an exciting period. There's great momentum. We have a vibrant community of practice, and thanks to the efforts of the Africa Evidence Network that has molded this field and through the activities that the network does, it's really helped to form this community of practice, which, in my view, is the strongest that the global community has. That Africa has the strongest community of practice in EIDM, and so I think we are at that point where I was chatting with Chris Chibwana, who just joined the Hewlett Foundation recently in the evidence-informed policymaking program there. And we're talking about what's next now. And I think in his words, he pointed out that we've done the evangelism of why EIDM is important. And we've done an excellent job over the last 10 years. We've built this strong network. I think now, as we go forward, we need to understand that, really EIDM, and through this evangelization, we've come to understand that EIDM is not just dissemination of evidence, that we are talking about evidence uptake. And when you're talking about coming up with strategies and interventions to promote evidence uptake in government, you have to engage with government. You can't do that from the distance. That we have to focus on the demand side, not only thinking about how do we get evidence to them, but understanding what are the bottlenecks that government and policymakers face in terms of the systems, in terms of their capacities, and so on, and that we have to deal with both the demand and the supply side. And we've come to the realization that EIDM, it's not enough to be a researcher, but there has to be further investment to turn researchers into EIDM experts. And for me, I'm a very, very good example of that. I don't think I would be doing what I'm doing now if it had not been for training that I did when I was a graduate student back in the US on effective communication of research to non-scientific audiences, which the Population Reference Bureau was running then. And so it's really a realization that we need now to say, okay, as the EIDM field, where do we go next? Where are the main gaps? We've created this demand. How do we now make sure that we help in closing the capacity and evidence gaps that are there based on the experience in the last 10 years? So for me, I can point out 2 or 3 things that I think are quite outstanding in terms of how we go forward. First, I think it's this issue defining what does institutionalization of evidence use actually mean. At AFIDEP, we talk about this from the perspective of making sure that whenever decision makers are making a decision, whether it's on priority setting, whether it's on budget allocation, whether it's on choice of interventions that will have the maximize the impact of the investments that governments are making. But even more critically, when we are talking about monitoring and evaluation of programs to improve performance, that at each and every one of these stages, whether it's in a hospital or in a school, people are making decisions on how to improve service delivery and so on. There should be evidence on the table to help them do this. So how do you make that happen? How do you institutionalize evidence use beyond doing workshops with policymakers and so on? So really, one of the things that we've tried to do at AFIDEP is to try to make sure that routine government training institutions actually adopt or institutionalize EIDM in their courses. We've tried to do this. Now I'm very, very glad to see that in Kenya, for instance, the Kenya School of Government has adopted the EIDM curriculum that AFIDEP developed, and now they are training their staff. In Malawi, the Malawi Institute of Management has just been turned now through a government act to become the Malawi Institute of the Malawi School of Government. And we are talking with them about how to make sure that EIDM is institutionalized there. We've done the same with the Center for Parliamentary Studies and Training in Kenya. The work that KEMRI James was talking about earlier, working with KEMRI to say, you're the research arm of the Ministry of Health in Kenya. How does KEMRI strengthen its link and partnership with the government so that you are really doing your work from the perspective of the needs of government? So there's that part. I think the other is even working with universities. AFIDEP has worked with African Academy of Sciences to say, how do we get these top university scholars across the continent to become EIDM champions beyond promoting their own research? How do we challenge universities to play a bigger think tank role in helping government, in various development issues that they are making? So we think that that's also a big area where we need to go into. The other issue is even just looking at how do we promote. Sometimes we talk about research a lot, but when we want to institutionalize use of evidence in government already collects a lot of administrative data. In the health sector, you have the health management information system, education have data, but you see that a lot of investment is made into this monitoring evaluation, monitoring data, but it's not used. So part of institutionalizing evidence use should focus on even not just talking about the synthesizing evidence that research is doing, but how do we make sure that the evidence that is already within government is being used for decision-making, especially at that operational level. And I think another key area we need to look at is how do we measure the impact of our interventions? How do we measure the impact of EIDM efforts? I think there's a gap there, and we need to join hands in going forward. I think as I end, Madam, the moderator, in 2018, we know the Hewlett Foundation convened this meeting of various experts from across the world to talk about the field of EIDM. How do we take it forward? And there were 4 areas that were identified there as areas that we could take forward in terms of taking this field. One was conceptualizing the EIDM field. How do we make sure that this is really being seen as a field? What are the concepts we should use and so on? The second was strengthening the messaging and stimulating public engagement around EIDM. How do we make this a household sort of issue in universities among experts and so on? And how do we message it in a way that it resonates with the goals of governments, which is really to transform people's lives. How are we contributing to that? The third was institutionalizing evidence in government. I talked about that quite a bit already. And the fourth one was running actors in the EIDM field under a global banner platform. Because at the end of the day, there has to be monies and resources to take EIDM to the next level. Can we mobilize the global community and governments to make commitments around this issue? So again, I'm excited to be here, and I revert the mic back to you, moderator, to see how we take forward the discussion. Thank you.
Excellent, thank you so much. Before I move on with some further probing of you all, I just wanted to, so we have I think a clarifying question from the audience to probably primarily directed to Velia, but open to others as well, which is what would be the role of the legislature in preparing evidence for debates in Parliament, and kind of, I guess, asking whether would they not be involved in the preparation of the evidence. So perhaps, Velia, you could clarify on that. Velia? Anyone else want to respond to this question?
I didn't quite get the question. I can't see it. I can't see the chat either. Maybe if you can just repeat.
So it's about the role of the legislature in preparing evidence for debates in Parliament. And I guess asking if they should they not be involved.
The role of what literature? I didn't get that word, sorry.
The legislative branch, legislature.
Right.
Actually, for me, I'm not getting the question clear. Is it in the chat?
So it is in perhaps we can come back to it. The chat function is a bit confusing, I have to say.
Yes.
So if I can ask the moderators to share this question and share all questions with all panelists, because I don't seem to be able to share direct messages with the panelists. And so
I can try to answer the question. I think it's typed again. It says, what would be the role of the legislature? Should they not be part of evidence synthesis? So, I mean, if you look at the legislature, we are looking at this, you have three arms of government, right? You have the legislature, you have the executive, and you have the judiciary. So the legislature, I don't know maybe what the question really means, because the legislature is part of Parliament itself. And I think what Velia was talking about was there's the MPs who do the legislation. We know MPs also have three roles: legislation, representation, as well as doing passing laws, oversight, and representation. So the passing laws, that's the legislative role, and a lot of the things that Velia was talking about. How do you strengthen the capacity of the parliamentary secretariat in supporting MPs in their legislative work? So I think the answer basically is that, yeah, they should be part of that, the evidence synthesis. And I think a lot of the work that we've been doing at AFIDEP, and I think many other players, I know they've been trying to build the capacity of the parliamentary staff in supporting parliaments in synthesizing evidence. But also this goes beyond just looking at how the staff themselves do this. The other issue is, how do you link various parliamentary organs or committees to technical organizations or research organizations that on a given issue could come and help do synthesis on evidence on a given topic. I don't know if that clarifies. Thank you.
I can come in.
Yeah.
I can come in as well. Should I come in?
Yes, please go ahead.
Yes, when I'm looking at the question, should the legislator not be part of the evidence synthesis? Yes, there are situations where members of parliament are required to be part of the synthesis. I will give you an example. When members are in a committee and they are about to carry out their inquiries or investigations, sometimes think tanks or stakeholders bombard them with a lot of evidence. And this evidence is usually in the background before they start the actual inquiry. Now, this is the moment where the legislature or the members of parliament are supposed to synthesize the different types of evidence that has been presented to them in order for them to carry out effective investigations or effective inquiries. Because at the end of inquiry or at the end of an investment, and at the end of an investigation, they need to come up with a report and recommendations. Now, these recommendations or this report is going to be an effective one once the members were involved in synthesizing the kind of evidence presented to them. This is just an example where I would say, yes, indeed, the legislature or members of parliament, they need to be part and parcel of synthesizing the evidence. But also, as Eliya highlighted, the members of parliament are responsible for representing their people, their constituents. So once they've got the technical information or the information, they also need to synthesize it for their people, for their constituency to get the information. I will give a recent example of COVID vaccines. We needed members of parliament to understand the role of the vaccines so that they could share with the same information with their people. So we cannot overemphasize the need for the legislature to be part and parcel of research synthesis or evidence synthesis. Thank you very much.
Thank you. Taryn, did you want to come in?
Yeah, thanks. But I just want to make a brief comment to say that in the world of evidence-informed decision making, or within this ecosystem, every one particular group doesn't have to be doing everything. I think that's the beauty of working together and playing to our strengths. So yes, we must be mindful. We must understand each other's worlds. We must have opportunity for engagement and connections between decision makers and the researchers. And then there's some parts of the activities linked to evidence-informed decision making that certain groups will get on with, and they will communicate that findings to those who need to make the decisions. And then there are other groups that are great at taking evidence synthesis and making it more digestible and understandable to those who need to make sense of the information. So I just wanted to highlight that it's an interplay of various actors fulfilling different roles, and ultimately all of us working towards the same common goal. Thank you.
Thanks, Taryn. So perhaps moving on, and I'll go to James first. Can you share some examples of developments in the African evidence ecosystem over the last 10 years that you think are significant? And what's the most important thing that you learned over this period?
Thank you so much, moderator, for that question. Indeed, the landscape for the last 10, 15 years, just as my colleagues have said, including my senior, Dr. Eliya Zulu has said, it's a big, big development. From the network, from the African Evidence Network, one of the things that I have learned is that the end stage is similar across board. We want evidence to be institutionalized in governments or any other institution, public or private, to be part of using locally generated evidence to inform their decision making. What I have learned from the various communities of practice in the last 9 AEN conferences is that they all use different pathways to get to that, to get to the end. When I was about 2 months ago, I was going back to the archives and reading the story of in Cameroon, where one of the AEN finalists was doing some good earnings, getting the healthcare workers in Cameroon to appreciate and own, the evidence. They use the evidence that they have generated, which is similar, which is a bit different to what the West Africans are doing, but the end game is always the same. Here, locally, we have done almost similar things, and we have learned that we are still on the pathway. The landscape is still young. We are still young, as Dr. Zulu mentioned, but we are running, and not walking. And therefore, that is one of the biggest parts that we have learned quickly, and we are applying the lessons. The second thing that has enabled us grow is technology. There is space for digital technology to support evidence making. Maybe during our in-person visits on Wednesday, I will probably share one of the technology platforms that we call I will be sharing with you on Wednesday one of our platforms that we have built, a digital knowledge translation platform that supports 5 components almost simultaneously from to support evidence use. So there is the role of technology. Machine learning is the big things to go to very soon. And I'll be sharing that much later on Wednesday, what we are doing about machine learning to support the synthesis and the repackaging of evidence that is locally generated, even regionally generated evidence to inform decision making. Finally, is that I have learned that we should team up as different sectors and cross-share or cross-fertilization of our experiences and getting to work together with other sectors. Right now, I can say that here at home, we are now talking of accelerating universal health coverage. And part of it is bringing the water sector, the education sector, the security sector. How can we, use the evidences that is available? Because we usually say evidence at KEMRI suggests that if you sort out the water sector, provide safe, clean drinking water to households in Kenya, you sort out 70% of their health problems. That is significant, but that is from various experiences. And you'll hear a parliament in Kenya talking about KEMRI's evidence. KEMRI suggests. So there is a need to have cross-sector or cross-fertilization across the various sectors. In the past, we have worked alone. And I think I picked this from somebody in Uganda in one, I think last year or the other year, AEN conference that, attempted to bring the water sector and the education sector together. Interesting story. And by the way, moderator, some of those little stories, we usually bring them back home and we tease them out, and we try to reach out to those members from across the region through the African network, the directory of some of the African champions. We try to reach out to them just to have a little further discussion on the how process. How do they do it? So, going to the future, 3 observations that I make. Number 1, embrace digital technology, machine learning. Number 2, cross-sector fertilization has to take place. We have worked in silos for far too long. Now we have to appreciate other evidences from other sectors to be able to have a total picture. That's more work. And the third thing, we still need to focus on the targeted users. That's one of the biggest lessons that I have learned from AFIDEP here in Kenya, when they took us through a course on communicating, that we can communicate our research output to 3 different audiences, but in 3 different styles. And we actually did it practically. And Dr. Eliya, Zulu, it worked. When you talk to the parliamentarians that CAT, or also called MIRA, is a stimulant and not a drug, that message in itself to the parliamentarians was good enough. To the academia, the chemical composition of CAT suggests it's a stimulant. The same message, but now we bring in the chemistry. And the same message to school children, CAT or MIRA does affect your dental or oral health. Please brush your teeth every time you chew CAT. So everybody gets the same message, and everybody runs with that message, and they are happy. Same message, different audience, different tailored. Little lessons that we have learned from AFIDEP, targeted message work. And that is where we are going. The future of knowledge brokerage will be staying on. Finally, moderator, as you bring in the literature, the research evidence, you need to triangulate that with, number 1, the tacit knowledge or the experience with the technical officers or the policy actors. You have to do that in fusion. This is what it says. This is what literature says. This is what you're experiencing. And then bring in the big data. It could be financial data, health. When you triangulate that, one of the things a knowledge brokerage will do is to note the fear associated with implementing the recommendation of the triangulation, the fear. So it is not about implementing new programs or recommendations, but the fear among the users of that evidence, whether it will work or it will backfire, and what will be the consequences, and how do we minimize the risk? All right? So how do we minimize the risk? Just understanding the fear component, I would advise knowledge brokers to listen carefully to words or sentiments that say this we can do, this we cannot do. All right? So that when you go to Tanzania, please do not talk about health rights. They will not listen anything to civil society and health rights. But when you tell them it's an emergency, this is a requirement, the change of the term makes it palatable. So we have worked. Why? Because the fear is that civil society it seems to be always against government. And even in government, and you seem to embrace civil society action on health, you are deemed to be anti-government, and you are likely to be kicked out. So you have the fear, but the knowledge broker is able to pick that fear and turn it into capital. So when you give me a bitter lemon, I will make lemonade as a knowledge broker. Those are the 4 areas, Madam Moderator, and I turn the mic back to you. Thank you so much.
Thank you so much, James, for those reflections. Taryn, what do you think are some of the most significant developments in the evidence ecosystem over the last 10 years, and what have you learned?
So thanks. I'm going to draw my response on the past few years and the response to the pandemic. In terms of producing research, often research teams have been working on their own, have been taking incredibly long to be able to start and finish the research as a product. And we've seen in the past few years how researchers have been responsive to the needs of decision makers and the questions that needs to be answered, how researchers have pulled together so that they can work faster, so that they can be nimble and produce the evidence in time so that the decision makers can use it to add the other layers of information that's required to make an evidence-informed decision. Linked to health and a mechanism for getting the evidence into a guideline. Within South Africa, various groups have been pulling together to conduct evidence synthesis rapidly, so doing rapid reviews that feed directly into national clinical guidelines. And then the next important step is that clinical guideline need to be implemented, because if the guideline is not implemented, it's not going to have the impact that we're striving to achieve. And there again is a whole new science linked to implementation science and being mindful of the various factors that influence the implementation of that particular strategy. So for me, starting as a researcher many years ago, where the focus was just on getting the research done, we have come a far way where researchers are mindful of the decision-making space, are able to be responsive and nimble and quick to be able to deliver the evidence while not compromising on the quality, because we need good quality evidence, robust evidence to feed into our decision-making. And then critically, that there must be mechanisms and support for that to be implemented in practice. Because I want to stress again, for me, the key thing is that we want to make a difference in the lives of the people within our country, in terms of their health, in terms of their well-being, on so many different fronts. And if we can't make that change, then what are we doing and what are we not doing? I think we need time to reflect on that, and we must make sure that whatever we do is to make a difference. Thanks.
Thank you so much, Taryn. Velia, over to you. What do you think are some of the most significant developments in the evidence ecosystem over the last 10 years, and what have you learned?
When I look at the past 10 years, there are some significant lessons which I've learned and which I would like to take them forward. In the implementation of evidence, one thing which I've learned and one thing which I've found to be so critical is leadership and the institutional structures for supporting evidence. If the leadership is not supporting evidence use in decision making, even if the evidence is available, that evidence will not be used. So one lesson which I've learned and one lesson which I would want to carry it forward is need for the leadership to champion evidence generation and evidence uptake. Because generating evidence is one thing. Using that evidence into decision-making is another thing. But when the leadership is championing this, everything works into play together. So that's the first lesson which I've learned, and that's something I want to take forward. And again, also, timing. when does evidence matter and to who? So to me, I've learned that timing is of essence, because sometimes your evidence may be needed yesterday and then you are bringing it later. That evidence may not be used. But then maybe that evidence, you are bringing it early before it is time for that evidence to be used. So for me, I've learned that the timing is also of essence when you want your evidence to be used. Because sometimes, I'm talking in terms of now as a person responsible for generating evidence. Sometimes we take a lot of time when generating that evidence without being mindful of when to release that evidence, to who, and at what particular time or at what particular moment. So timing is also something which we need to be mindful as we move forward. And again, I also borrow the words used by James here to say evidence need to be targeted. Because I've learned, having worked for Parliament for so many years, so sometimes you look at who will use that evidence. So making sure that evidence is targeted is also something that can assure you that evidence will be used. So these are the 3 lessons which I've learned and something which I would want to move forward. Thank you.
Thank you, Velia. Eliya, over to you.
Thank you, Birte. I think for me, in my area submission, I kind of highlighted a lot of these, and I think building just to reinforce what I said, but also building on what others have said, Taryn and Velia and James. Really, I just want to emphasize the fact that for me, the biggest lesson is when you come in to really promote EIDM or as an EIDM champion, I think when you do this work from the perspective of the needs of policymakers, it forces you to work differently. And I think when we talk about really trying to institutionalize a culture of consistent use in evidence, and you really need to understand, I think Velia talked about the issue about the need for leadership and supporting structures within government. I think if it's a question of just getting one line of research and working with government to promote its use, you could be successful there. But I think the point about making sure that even when you are not there, what are the questions the policymakers are asking to the consultant that they have hired, so that the evidence that is put on the table is really, speaking to their needs and so on. So that's why the whole point of institutionalizing the culture, making sure that you are not only improving the skills of the middle level decision makers and so on who actually write technical documents, but you're also working with the leadership, so that the leadership, the ministers, the PSs, the management team at the Ministry of Health or in education and so on, is actually evidence cautious. And when the documents come to them, they ask those questions to say, on what basis are you recommending this? Did you look at all the evidence and that sort of thing? So I think it's the issue about systems of evidence use. At AFIDEP, we are just completing a project we've been doing with WHO on saying, how do you actually improve systems and the structures for evidence use in the Ministry of Health? And we've been working with technical working groups, because these are the critical groups that make key recommendations to the management. And so we think that by working with these teams and strengthening the way research they engage with research and other related evidence, that's the way you make sure that consistently there'll be that use of evidence. The other point really is on the need to expand the community of practice. And I think Taryn talked about that quite a bit, that there's we have to look at how we reinforce each other in the field. But I think I talked earlier even about the need to make sure that the government training institutions, universities actually are having EIDM training beyond training people in research skills. So again, just to sum up there, I think we've been working at AFIDEP again with the Kamuzu University of Health Sciences, where we've set up a policy lab at the Ministry of Health, where every quarter we meet with the management in the ministry to look at what are the issues they are looking at. And then you relay all that information to researchers within the research community in Malawi to see how do we help the government in actually addressing their needs and so on. So for me, that issue, the biggest lesson, and I think that's where a lot of focus needs to come in, is how do we engage with government to promote EIDM from the perspective of their needs, even as we are bringing in other critical data that will allow them to shift and maybe prioritize different issues that, that they are not looking at. Thank you.
Thank you so much for that, and we're at time. I think this has been a really, Eliya, you started your comments by highlighting how exciting and vibrant the African evidence community is, and I think that this session has highlighted that, and there are lots of I think lessons and key topics coming out that I'm sure we'll have a chance to discuss in more detail during the conference. And Siziwe, I hand over to you to tell us more about